All right, Dr. Brian McKay, Core Health and Darien. Let you know, Neon Trac Solution, great way to eliminate your pain. But we're not here to talk about the Neon Trac Solution, but it does work phenomenally. We're going to talk about what can knee pain do. Now, I get hit with a lot of questions. Can knee pain cause nausea? If it hurts bad enough, anything can cause nausea. So, quite possibly, knee pain can cause nausea. All right. Now, another question I get, and this is a really good one. Can knee pain be caused by the hip? Well, mechanically, the hip is involved. I mean, how many hip replacements do we see people going through at this day and age? Tons. All right. So, yes, knee pain can be caused by the hip, but also you really want to examine the whole area. You want to check the foot, make sure the mechanics. It's a unit. It's a motor unit. It's a lower motor unit. So the entire, if you have knee pain, you got to check the hip. Chances are it's going to be something affected by the hip. It's also going to be affected by the feet. So you really, really, really have to understand that, and the hip can cause knee pain. The femur is the top. That's the thigh bone, and the shin bone would be your tibia. And what happens is at the end, as you open up that hinge movement and you fully extend the leg, that's when you kick the leg out. When you extend the leg, at the very last minute, there's like a screwing motion to lock the knee into place, and that's so basically the femur is part of your hip, so very very much so. Typically, we can find that the hip joint or the femoral neck that inserts into the hip socket can subluxate forwardly, but also can rotate internally or externally. So these are things you want to check out and be sure of. The other question is, can knee pain cause ankle pain? I'm going to go on a limb and say it's probably the ankle pain first. I mean, look where you put most of the weight on. Look at how much bigger it is. And if you have ankle pain, sometimes you're not aware of it. You check out ask somebody you love to see how you walk. Or better yet, take out your iPhone. Most of us have them, and videotape. Have somebody video. I'm really still showing my age here. Have them show you. Watch what you look like walking, because you have to examine the entire motor unit. I do get some silly questions. I just answer them. Can knee pain be serious? Hell yeah. You can have a tumor in your knee. You can have certain bone cancers in the knee. So knee pain can be serious. If you don't start feeling better after a while, an X-ray just may not be enough to cut it. You may need a bone scan. Certainly an MRI is in order if you have chronic knee pain. So don't be afraid of getting these tests done, because occasionally they're just way, way more serious. I had a recent patient with a young lady with a hip pain. Turns out she had a tumor in the femoral neck. So this does happen. But a lot of these things can be treated if they're caught early. So if you ignore your pain and just take Advil and leave, which, listen, you got to get through the day. I understand it. But chronic knee pain doesn't go away. It needs to be addressed. And that's where I tell you the Neon Trac Solution could be your answer. So, as far as, I guess best thing is knee pain can be cured. A lot of times you do need a rash of physical therapy. Some things you can do at home simply. Sit yourself in a solid chair. Don't hold on to the armrest with your hands, and just try to go to a standing position. Now, I recommend doing it on a chair with an armrest, because if you're older, you can start to do that. Do that 10 times in a row, see how you feel. Then you do it 15 times in a row, 20 times in a row. Push it. I mean, you could do 10 sets of that a day, and that's going to strengthen the primarily, it's going to work your core, which is always a good thing, but it also work the rectus femoris, which is the muscles in the leg that typically I see with knee involvement. And I'm just giving you the big ones. There's the rectus femoris, which if you slide your hand across the top of your leg if you're sitting down, and then the vastus medialis is what you would do if you go to the side. Like if you start with your hand right at the upper thigh and slide it out to the midline, that's the vastus medialis. You also have a muscle called sartorius in the thigh. We're talking about the anterior portion of your leg. And that's going to be involved too sometimes. Lower leg, tibialis anterior, but the mechanics of the foot get thrown out. If you're tight in the hip, it can definitely relate to the knee, which then can also relate to the ankle. So the question is, who's best to treat it? That's only, I know we do a damn good job here at Core Health Darien, but you may not be in the Stanford, Darien, Norwalk, New Canaan area to get our services. Now, we do not do purposely. We don't do post surgical knees or hips. I'd rather go to a different physical therapy center for that. But for the lower level hips, knees, and feet, we do a really good job, and it's going to prevent you from having osteoarthritis and chronic pain. Chronic pain changes who you are. You don't need it. So these are the different things we can help. Can knee pain cause nausea? Not so much. Can knee pain be caused by the hip? Hell yeah. Can knee pain go away? Certainly, knee pain can go away. But you have to understand, it's not just a pill. But now let's take that back. If you have psoriatic arthritis, your knee pain might not go away. Rheumatoid arthritis, maybe it's not going to go away. It can be managed, and that really does need to be managed with the biological drugs that are on the market today. And I won't go into that because if you have RA or psoriatic arthritis, which affects joints, you need to be seeing your rheumatologist and have that managed properly. And you also need to know that you have to do your part as far as exercise. If you're not exercising, well, basically, if you're not going to exercise and you got knee pain, you're talking to the wrong guy. It's not going to get better on its own. Listen, it's Sunday, the day before Memorial Day. I wish you a happy, healthy Memorial Day. I'm Dr. Brian McKay, Core Health in Darien. Very thrilled with the results we're getting for the Neon Trac Solution. I'd have to explain that more in person. You can reach us 203-656-3636, 203-656-3636. Have a great, healthy, happy Memorial Day. Stay healthy. Dr. Brian.